Hello guys, welcome back to Medicodiy, and today in this video we'll be talking about trigeminal neuralgia. Now before talking about trigeminal neuralgia, let's talk about the trigeminal nerve. The trigeminal nerve, it is the fifth cranial nerve and it has got three divisions, that is the ophthalmic division, maxillary division and the mandibular division. And in trigeminal neuralgia, it most commonly affects the second or the third division of the trigeminal nerve. Talking about the trigeminal neuralgia, it is characterized by unilateral lancinating facial pain, and as I've said earlier, it commonly affects the second or the third division of the trigeminal nerve, and the age of presentation is 50 years or greater than that. Talking about the pathophysiology, it is idiopathic in most of the cases, while in some cases it is caused due to the irritative lesion involving the trigeminal root zone or an aberrant loop of an artery, or compressive lesions involving the nerve root, or in association with multiple sclerosis, it occurs due to the plaque of demyelination in the brainstem. Clinical features. The age of presentation is more than 50 years and it is characterized by facial pain, which is repetitive, severe and very brief, lasting for seconds or even less. The pain may be triggered by touch, cold wind or even eating. The physical signs are usually absent, although the spasms may make the patient wince and sit silently, that is tic douloureux. There are remittent relapses over many years, and rarely cluster tic can be found, that is, there is combined features of the trigeminal neuralgia and the cluster headache. For diagnosis, it is mostly diagnosed on the basis of the signs and symptoms, but to rule out the differential diagnosis and to look for multiple sclerosis, we can do MRI, CT scan, and angiography can also be done to look for an aberrant loop of an artery. The differential diagnosis of the trigeminal neuralgia is pain of dental origin. It can be, the cause can be extracranial, neuropathic, neurovascular, or even psychogenic. Talking about the management can either be medical or surgical. In medical, we can give carbamazepine, and it is started with a low dose and it is increased gradually. And the alternative to carbamazepine can be oxcarbazepine, gabapentin, pregabalin, amitriptyline, and glucocorticoids. Talking about the surgical treatment, we can, if there is an aberrant loop of an artery, we can do decompression of the vascular loop encroaching upon the trigeminal root, or the localized injection of alcohol or phenol into the peripheral branch of the nerve can also be done. It is one of the simplest form of treatment. And making a radiofrequency lesion in the nerve near the Gasserin ganglion can also be done. This much for today. Hope you enjoyed the video, and do comment on which topic I should make the videos, and stay tuned for more videos. Thank you.